Kevin Wang is a CFRA senior equity research analyst who covers biotech and medtech. And Kevin, you raised your price target yesterday based on this news, but you raised it to $363 from just $228. Your new price target is still below where that stock traded yesterday. So should we count you in the skeptics in terms of the company being able to get reimbursed or maybe make a real go of this?
I'm certainly still a bit of a skeptic. I think that the launch will be slower than most people anticipate. One of the main reasons is that there's only 18,000 neurologists in the U.S. by our estimates, whereas there's over 5 million patients who might be treatable by aducanumab. And on top of that, there are protocols in place such as MRI scans before treatment and during treatment, and also constant monitoring that are going to increase the burden of sort of the physicians and keeping track of the patients. And then this confirmatory study is also going to probably make some payers and physicians hesitant to prescribe the drug. So I think there are certainly challenges for aducanumab before it's widely reimbursed.
You know, let me just play devil's advocate, take the other side of this. For the loved ones of patients of Alzheimer's, this is incredible hope. It's the first time there's something new, some new treatment, some new therapy in 18 years. And you can imagine that people are going to be lining up behind this, hoping that their relatives can qualify for this, that they can start taking this. I do realize it's an incredibly expensive price, $56,000 versus the $10,000 to $25,000 that a lot of analysts and industry watchers had anticipated. But I guess it comes down to, will insurance companies pay? If they think it's effective, insurance companies might just do that because Alzheimer's is such a costly disease. You can live for forever while your brain is not there, so you can't take care of yourself. It's something like $600 billion a year that the United States spends on trying to care for Alzheimer's patients. I guess that comes down to it. When do you think we'll have a clearer idea about the efficacy, about whether this works?
I think the confirmatory studies are likely going to take a few years to show if there is efficacy or not. But based on the results we've seen so far, even if it does prove to be efficacious, we think that it's not a clinically meaningful amount, as we saw from the results from the earlier trials that Biogen ran. We were looking for a decline of 1 to 2 points on the CDR-SB scale, which was the endpoint that was used by Biogen, but they only had a decline of about 0.5, which suggests that this might be giving patients false hope by approving this early, and it's going to cost U.S. taxpayers a lot of money as well.
One of the things I've seen is that the earlier you take it, maybe the more likelihood of success. That also seems pretty tricky. How do you convince somebody to pay for this before you are showing huge signs and huge strains of Alzheimer's of the onset?
Yeah, it's definitely very tricky. These patients need to be identified early that they are at risk of Alzheimer's disease, and they're going to need brain scans early because if they're caught too late, then the drug doesn't really help much.
I guess finally, Kevin, if there was something that would change your mind, what would you have to see before you thought, okay, this has a better shot than I'd anticipated?
I think maybe if while they're running the confirmatory studies, we see in the subgroup of patients that had a really strong response to the drug, if we see that gets the response is higher than what we had seen previously, perhaps it could prove to be clinically meaningful. And in that case, I think, aducanumab might be beneficial and payers might be willing to reimburse it. But we think that approving it in its form is kind of a risk because now other competitors are going to be submitting similar drugs that sort of meet this low bar. And we're imagining the competitive landscape is going to change drastically over the next decade.
Shepard Smith here. Thanks for watching CNBC on YouTube.